catching a cold is unavoidable for most people. While cold symptoms are usually mild and short-lived, the sneezing, runny nose, and sore throat can last up to 2 weeks. These symptoms tend to resolve on their own, but they can be annoying, and most people want to avoid them. Fortunately, there are things you can do to reduce your risk of getting a cold. The best way to completely stop a cold before it starts is to avoid people who have a cold. But this can be hard. This is because you can spread a cold virus before you develop symptoms. Not only that, more than 200 different viruses cause the common cold. So dodging them is hard. What can you do once you feel the scratchy throat and runny nose coming on? Let's take a look at how the research supports 7 common cold remedies. First, reduce stress. Research shows that stress can reduce your immune response. A weakened immune system can make you more susceptible to many different infections. In one study, researchers found that people who reported higher levels of psychological stress had higher rates of infection when exposed to a cold virus. The greater the reported stress level, the higher the rates of infection. Second, try zinc. Zinc is an essential mineral found in the foods we eat. Zinc is also marketed as a supplement to help ward off colds. There's evidence that zinc can reduce the severity and duration of a cold. But in order to reap this benefit, you need to begin taking zinc within 24 hours of first noticing cold symptoms. You may start to feel better about a day sooner, on average. Unfortunately, there's no data to show that zinc can prevent you from catching a cold in the first place. It's best to stick to zinc lozenges or supplements you take by mouth. Zinc nasal sprays have been linked to a loss of smell, so you may want to avoid those. Third, take vitamin D if your levels are low. Vitamin D supplements won't prevent you from getting a cold if you have normal vitamin D levels. But many people have lower than normal vitamin D levels, especially in the wintertime. Since vitamin D plays a key role in keeping your immune system healthy, it makes sense to ensure you maintain healthy vitamin D levels. In fact, there's evidence that people with low vitamin D who take vitamin D supplements get fewer colds. Fourth, drink lots of fluids. There's no scientific evidence that drinking lots of fluids helps ward off or treat a cold. That said, it's conventional wisdom to replace any fluids you lose, especially if you have diarrhea or vomiting. But don't overdo it. Overhydrating with pure water can lead to dangerous complications, like low sodium levels in your blood, also called water intoxication. Fifth, eat nutritious foods. The food you eat provides the building blocks for a healthy body. Building your immune system requires getting adequate nutrition all year round, not just when you're exposed to a cold virus. Prioritizing nutritious foods every day means you're ready to fight off a cold virus when it inevitably hits. Your food choices also matter when you start noticing cold symptoms. Some foods, like garlic, ginger, and honey, can improve your symptoms. Meanwhile, other foods high in refined sugar might make them worse. Sixth, rest up. Getting good sleep regularly may help fend off colds. Some evidence suggests that people who sleep fewer than 6 hours a night catch colds more easily than those who sleep more than 7 hours. Another study showed that people who slept fewer than 7 hours a night were at least 3 times more likely to develop cold symptoms than those who slept more than 8 hours a night. It's best to strive for at least 7 to 9 hours of sleep each night for the best health, and this may help keep cold symptoms at bay. Seventh, wash your hands. The CDC estimates that 1 in 5 respiratory illnesses could be prevented by routine hand washing with soap and water. When out in public spaces, you may want to be more mindful of keeping your hands clean. If you're unable to wash your hands with soap and water, you can use a hand sanitizer with at least 60% alcohol after touching any surface. While this may not help your symptoms once they develop, it may help keep you from spreading germs to others. Most colds go away on their own. But sometimes they can turn into something more serious, especially if you have an underlying medical condition. Call a healthcare professional if your symptoms start to get better but then worsen. Your symptoms last 10 or more days. Your fever lasts more than 3 days. You have shortness of breath. You have chest pain or dizziness, or you cough up bloody mucus.